As a physician who has dedicated over 4 decades to caring for the elderly, I've witnessed countless stories, some inspiring, many heartbreaking, that have shaped the way I understand aging and health. Now retired, I feel compelled to share with you a truth that's often overlooked, even misunderstood, in the world of senior care. It's a truth that may very well challenge everything you thought you knew about a simple daily ritual: bathing. Imagine for a moment the countless mornings and evenings you, or someone you love, has spent in the bathroom, stepping cautiously into a slippery shower or a cold bathtub, perhaps feeling a mix of relief and exhaustion afterward. We've all been told that bathing every day is non-negotiable, the key to staying clean, fresh, and healthy. That the absence of this routine risks not only odor or discomfort, but also disease. But what if I told you that this well-intended practice, so deeply ingrained in our minds, might actually be harming the very people it's meant to protect? What if the daily bath, the ritual that promises cleanliness, is quietly stripping away layers of skin, vitality, and even independence? For years, I've watched patients whose skin, once resilient and supple, has become fragile, cracked, and painful. I've seen those same patients struggle with debilitating falls, some resulting from nothing more than the treacherous surfaces of their own bathrooms. Behind these events lies a pattern many fail to recognize: an unyielding commitment to a hygiene routine that doesn't fit the reality of aging bodies. Skin is our first line of defense and armor against the world. But after the age of 70, this armor thins. The natural oils that once protected it diminish. The strength and elasticity fade. And every time a senior steps into a hot shower or soaks in a tub for long periods, their skin's fragile balance is further disrupted. This isn't a minor inconvenience, it's a silent assault, often overlooked until the damage becomes visible, painful, or even dangerous. More troubling is the toll this routine takes beyond the skin. I recall a patient, Mrs. Anderson, a spirited 78-year-old woman who loved gardening and spending time with her grandchildren, but her daily shower was a source of anxiety and fatigue. Each step into her bathroom was a calculated risk. Her balance wavered, and one careless slip could have changed her life forever. Sadly, I've seen too many cases where that risk turned into reality. Falls in the bathroom are the leading cause of serious injury among seniors. And the frequency of these accidents is tied closely to how often seniors expose themselves to these hazards. This reality is why I want to invite you to rethink the old wisdom about bathing. What if less frequent bathing could actually protect skin, reduce falls, conserve energy, and improve quality of life? What if stepping back from the daily ritual is not a sign of neglect, but a step towards safer, smarter self-care? Throughout my years as a doctor, I've learned that aging demands flexibility, not stubborn adherence to routines designed for younger, more resilient bodies. The human body is remarkably adaptive, equipped with its own natural cleaning systems that work quietly beneath the surface, maintaining balance and protection. When respected, these systems thrive. When overwhelmed, they falter. So today, I'll share insights drawn from science, clinical experience, and the stories of real people. Together, we'll explore how bathing less often can be a lifeline rather than a compromise. We'll look at safer alternatives, how to keep clean without putting yourself at risk, and what experts now recommend for seniors just like you or your loved ones. If you're willing to open your mind and perhaps reconsider a practice you've trusted your whole life, please subscribe to this channel and turn on notifications. Supporting this channel helps me continue sharing valuable, evidence-based advice that can transform how we approach senior care, not just for the elderly themselves, but for the families and caregivers who love them. Before we move forward, I want to leave you with a question to reflect on. If you had to choose between taking a shower every day to maintain the traditional idea of cleanliness, but risking dry, damaged skin and the potential for falls, or bathing less frequently, embracing a safer, scientifically backed routine that protects your skin and reduces risk, even if it means redefining what cleanliness means to you, which would you choose? Please comment your answer below A or B, and share your thoughts. Your response helps build a community where we can all learn from each other's experiences. As a physician who has cared for elderly patients for many decades, one of the most profound changes I've observed is how the skin, the body's largest organ, transforms with age. Skin is not merely a passive covering. It is a living, breathing shield, intricately designed to protect us from countless threats. But as time passes, the strength of this shield wanes, and understanding these changes is essential if we are to safeguard the health and dignity of older adults. After the age of 70, the skin undergoes a series of physiological changes that are as inevitable as they are profound. The outermost layer, called the epidermis, thins significantly. Beneath it, the dermis, the layer responsible for elasticity and support, loses vital components like collagen and elastin. These proteins, which keep skin firm and supple, diminish due to natural aging processes. The result is skin that is more fragile, less resilient, and prone to damage. In my years of practice, I've seen countless patients whose skin once glowed with youth and vitality but has become dry, rough, and cracked. This is not just a cosmetic issue. It is a medical concern with serious implications. The sebaceous glands, responsible for producing the natural oils that keep skin moisturized, slow their activity drastically as we age. Sweat glands too become less active, which means the skin cannot regulate moisture effectively. Without these oils and sweat, the skin loses its natural barrier, leaving it vulnerable to environmental insults, allergens, and pathogens. What many don't realize is that frequent bathing, especially when done with hot water and harsh soaps, accelerates this deterioration. Each shower strips away the limited natural oils remaining on the skin's surface. This can cause an uncomfortable sensation of tightness and dryness, symptoms that many older adults experience but often dismiss as just part of getting older. One condition I frequently diagnose in my elderly patients is xerosis, a severe form of dry skin. Xerosis transforms the skin into a fragile, scaly landscape, sometimes marked by painful fissures and cracks. These aren't minor irritations. They are breaches in the skin's protective armor. Such cracks can bleed, become infected, and exacerbate underlying skin disorders such as eczema or dermatitis. I have seen patients suffer from recurring infections because these wounds allowed bacteria easy access into the body. In fact, the risk of skin infections in seniors is alarmingly high. The skin's weakened barrier struggles to keep harmful microbes at bay. Bacteria like Staphylococcus aureus, which can live harmlessly on healthy skin, turn opportunistic when this defense falters, causing cellulitis and other infections that often require antibiotics and hospitalization. For seniors with diabetes or compromised immune systems, these infections can quickly become severe. Scientific research supports what I've witnessed clinically. Studies from reputable institutions like the University of California, San Francisco, have documented the marked decline in skin integrity with age. These studies also highlight how overwashing exacerbates dryness, irritation, and inflammation. I recall one patient who, despite following advice to maintain daily showers, developed painful cracks on her heels and lower legs, which led to repeated hospital visits. Beyond the physical discomfort, these skin issues have profound psychological and practical consequences. Persistent itching and discomfort interfere with sleep and daily activities. The pain from cracked skin can make dressing or walking difficult. For seniors already struggling with mobility or arthritis, the effort to shower daily already taxing becomes a source of stress and exhaustion. It is crucial to understand that the damage caused by daily bathing is not immediately visible. It is a gradual erosion of skin health that can silently progress until serious problems arise. Many seniors do not connect their dry, irritated skin with their hygiene routine. They believe more frequent washing equates to better cleanliness and protection. But this belief is outdated and, frankly, dangerous for aging skin. Moreover, the products we often associate with cleanliness soaps and detergents pose hidden threats. Many commercial soaps have alkaline pH levels far above the skin's natural, slightly acidic pH of around 4.5 to 5.5. This acidity is vital for maintaining the skin's microbial balance and barrier function. Alkaline soaps disrupt this delicate balance, stripping away friendly bacteria that help protect the skin and leaving it vulnerable to irritation and infection. Hot water compounds the problem by dissolving the lipid bilayer, the microscopic film of oils and fats that bind skin cells together and lock in moisture. Repeated exposure to hot water essentially depletes the skin's natural defenses, leaving it parched and defenseless. As a doctor, I've seen how even seemingly innocent habits like long hot baths can be the catalyst for chronic skin problems in seniors. Yet skin is not helpless. It has remarkable, though diminished, capacity to repair itself if given the right conditions. The key is minimizing unnecessary damage and supporting its natural balance. This means recognizing that the old adage of daily bathing for cleanliness does not hold true for everyone, especially those with aging skin. When we talk about bathing frequency for seniors, we are not advocating neglect. We are calling for a gentle, evidence-based approach that respects the vulnerabilities of aging skin. This includes adjusting water temperature, using milder, pH-balanced cleansers, and most importantly, reducing how often full-body baths occur. One of the most rewarding moments in my career has been helping patients transition to these safer routines. I've witnessed dramatic improvements in skin condition, reduced discomfort, and fewer infections simply by advising them to bathe less frequently and adopt alternative cleaning methods. For many, this change is life-changing. Understanding the science behind aging skin is fundamental for caregivers, family members, and seniors themselves. It is the foundation upon which safe and effective personal care routines must be built. In my next discussion, we will explore how these skin changes intersect with the physical challenges seniors face in the bathroom, and why bathing less often is a critical step in preventing serious injuries. But before we move on, I encourage you to think deeply about this. Our skin is more than just a surface. It is a complex living barrier, one that demands respect and care, especially as it ages. Treating it with harsh routines out of habit or misconception may do more harm than good. In the coming parts, I will share with you practical advice grounded in decades of experience and scientific knowledge. Advice that can help you or your loved ones maintain dignity, health, and safety through the later years of life. As a physician who has spent decades caring for the elderly, I have witnessed firsthand how something as routine as a daily bath can become a silent threat to the health and independence of seniors. While much attention is rightly given to the effects of aging skin, there is another, often overlooked danger lurking in the bathroom: the risk of falls and the physical strain imposed by frequent bathing. Understanding this risk is essential, for it is not only skin damage but also life-altering injuries that can result from a seemingly simple daily habit. The bathroom, ironically, can be one of the most hazardous places in the home for older adults. It is a confined space filled with slick surfaces, ceramic tiles, wet floors, smooth enamel tubs that, under the right conditions, transform into treacherous terrain. The Centers for Disease Control and Prevention report that more than 1 in 4 adults over the age of 65 experience a fall each year. Even more concerning, these falls are a leading cause of emergency room visits, hospitalizations, and deaths among the elderly population. What many fail to realize is how closely these accidents are tied to daily bathing routines. I recall a patient of mine, Mr. Thompson, a robust 75-year-old who took great pride in maintaining his independence. He insisted on showering every morning, despite my gentle warnings. One morning, the inevitable happened. As he stepped into his bathtub, his foot slipped on the wet surface. The resulting fall fractured his hip, and the consequences rippled through every aspect of his life. From that day forward, his independence was compromised, and the recovery was long and arduous. Sadly, Mr. Thompson's story is far from unique. Physiologically, aging brings with it a decline in muscle strength, slower reflexes, impaired balance, and conditions such as arthritis and neuropathy. These changes make navigating a slippery, confined bathroom especially perilous. Daily bathing requires multiple physical actions: stepping over tub edges, standing for prolonged periods, reaching and bending to wash difficult areas, and finally, drying and dressing afterward. Each of these movements demands coordination, strength, and endurance that often diminish with age. Moreover, sensory changes, including diminished tactile sensation and vision impairment, can increase vulnerability. Imagine trying to maintain balance on one leg while your foot searches for purchase on a slick surface, your eyes obscured by steam, and your body fatigued from years of wear. The risk of a misstep in such a situation is staggering. And yet, this routine is repeated every day by millions of seniors, often without adequate safeguards in place. Time of day also plays a crucial role. Many seniors bathe during early mornings or late evenings times, when drowsiness or exhaustion may be heightened. Fatigue can dull awareness and impair reaction times, increasing the risk of falls. In clinical practice, I have seen how even a single fall in the bathroom can cascade into a loss of confidence, reduced mobility, and social isolation. The consequences of falls extend far beyond the initial injury. Hip fractures, for example, carry a high mortality rate within the first year for older adults. Traumatic brain injuries from bathroom falls can lead to lasting cognitive decline or disability. Even less severe injuries may lead to hospitalization, loss of independence, and the need for long-term care. The psychological impact, fear of falling again, can itself become a barrier to normal activity, perpetuating a cycle of decline. One might ask then, how can this risk be mitigated without sacrificing personal hygiene? The answer lies in rethinking bathing frequency and adopting safer alternatives. Reducing the number of full-body baths to once or twice a week can dramatically decrease exposure to hazardous bathroom conditions. Supplementing these baths with targeted hygiene practices, such as sponge baths or cleaning with wet wipes for high-risk areas like underarms and groin, can maintain cleanliness while minimizing risk. Environmental modifications also play a vital role. Installing grab bars, using non-slip mats, and employing shower chairs can create safer bathing environments. However, no amount of adaptation can fully compensate for the sheer frequency of trips into the bathroom on a daily basis. By cutting down on bathing occasions, seniors reduce their chances of encountering these risks. Energy conservation is another important consideration. As we age, stamina diminishes. The act of bathing, stepping in and out, standing, washing, drying can be exhausting. This physical drain not only increases fall risk, but can also diminish quality of life. Seniors may forego other vital activities, such as exercise or social engagement, due to fatigue induced by daily bathing. Encouraging less frequent bathing helps preserve energy reserves for more meaningful pursuits. In my clinical experience, I have found that patients who adopt reduced bathing schedules often report feeling more energetic and less stressed. Their caregivers note fewer injuries and improved overall well-being. It is a balance between maintaining dignity through hygiene and ensuring safety through mindful routines. In closing, the risk of falls and physical strain from daily bathing is a silent but serious issue that demands our attention. As a doctor who has seen the devastating consequences of these falls, I urge seniors and their families to reconsider the traditional norms of hygiene. Embracing safer, more individualized bathing routines not only protects the skin but safeguards life itself. In the coming discussions, I will explore expert recommendations and practical hygiene alternatives designed specifically for seniors, empowering them to live with both cleanliness and safety. Over my many years as a physician specializing in geriatric care, I have come to appreciate that aging demands a new approach to something as fundamental as personal hygiene. What once seemed simple, the routine daily bath, now requires careful reconsideration. The evidence and expert consensus have evolved, recognizing that seniors need hygiene practices tailored to their unique physiological and safety needs rather than the rigid standards inherited from younger years. Leading organizations in dermatology and geriatrics, such as the American Geriatric Society and the American Academy of Dermatology, now recommend that many seniors bathe only once or twice a week. This recommendation stems not from a desire to reduce cleanliness, but from a deep understanding of aging skin's vulnerability and the physical risks frequent bathing poses. It reflects a shift from a one-size-fits-all hygiene rule toward a personalized, compassionate standard that prioritizes both health and safety. The key to effective hygiene for seniors lies in balance and adaptation. Full-body immersion every day is often unnecessary and can do more harm than good. Instead, targeted cleaning strategies that focus on areas most prone to sweat and odor, such as the underarms, groin, and face, offer a practical, gentler way to maintain cleanliness. I have advised countless patients and their families to adopt such strategies, replacing daily showers with sponge baths, gentle wipe-downs, and careful hand washing. These approaches preserve the delicate balance of the skin's microbiome, the invisible community of beneficial bacteria and fungi that protect against infection and maintain skin integrity. It's essential to recognize that the skin's microbiome is not an enemy but a vital ally. As seniors, the natural diversity and population of these microbes decline, making the skin more susceptible to disruption. Overuse of harsh soaps and daily scrubbing can decimate these microbial populations, leading to irritation and increased infection risk. By limiting bathing frequency and using mild pH-balanced cleansers, we help support this natural ecosystem rather than undermining it. Moreover, individual circumstances must guide bathing routines. A retired individual who spends most days indoors with minimal physical activity may accumulate far less sweat and dirt than someone who remains active, gardening or exercising regularly. Those living with incontinence, chronic wounds, or other medical conditions may require more frequent or specialized cleaning, but even then, full immersion baths can often be minimized. It is a delicate dance between meeting hygiene needs and respecting the limitations of aging skin and body. In my years of practice, I have witnessed remarkable improvements in skin health and overall well-being when seniors move away from daily bathing toward this more nuanced regimen. Dryness, itching, and cracking diminish, and the risk of skin infections decreases significantly. Patients report feeling less fatigued and more comfortable, often with renewed enthusiasm for daily life. This new understanding also brings dignity and empowerment. Hygiene should not be a source of struggle or risk, but a means of self-care that honors the body's current state. Simple tools, wet wipes, soft cloths, gentle cleansers become indispensable allies. Changing clothes regularly and maintaining oral hygiene further contribute to a sense of cleanliness without the burden or danger of daily showers. Families and caregivers play a crucial role in supporting these adapted routines. Encouraging and assisting seniors in targeted cleaning, ensuring safe environments, and understanding the reasons behind reduced bathing can alleviate concerns and improve compliance. Education is paramount, and as a retired physician, I have devoted much effort to sharing this knowledge in hopes of preventing unnecessary suffering. In climates where cold weather prevails, the risks of wet hair and chilled environments after bathing must be weighed carefully. For some seniors, dry shampoo or warm sponge baths can provide cleanliness without the physical and environmental stress of full showers. It's about customizing care to individual needs, preferences, and comfort. The journey towards safer hygiene is not about lowering standards. It is about redefining what cleanliness means in later life. It is about wisdom recognizing that the body's needs change and that true health encompasses skin integrity, safety, energy preservation, and psychological well-being. As you consider these expert recommendations, remember that the ultimate goal is a life lived fully and safely. When bathing becomes a risk rather than a comfort, it is time to change the approach. Hygiene adapted to aging skin and body function is not only possible but profoundly beneficial. In the final part of our discussion, I will explore how these principles translate into practical steps and everyday habits, empowering seniors to maintain their dignity and health with confidence and ease. As I reflect on a lifetime devoted to caring for the elderly, I am reminded that aging is a journey both delicate and profound. It calls for patience, understanding, and above all, respect for the natural changes our bodies undergo. When it comes to something as seemingly simple as bathing, the lessons I've learned underscore a vital truth. What once was routine may no longer serve us well, and embracing change is essential for aging with grace and dignity. The daily bath, so ingrained in our cultural norms, has long been championed as a pillar of cleanliness and health. Yet for seniors, this ritual can quietly undermine the very foundations of well-being. Fragile skin, increased fall risk, energy depletion, these are not abstract risks, but lived realities for many of those I have cared for. It is a paradox that what we often think of as care can become harm. But there is hope, and there is wisdom in adapting our habits. Through decades of clinical observation, patient stories, and advancing scientific understanding, it has become clear that reducing bathing frequency is not a surrender but a strategic choice. It is an act of kindness toward one's own body, a recognition that less can indeed be more. By bathing once or twice a week and supplementing with gentle hygiene practices, seniors preserve the delicate balance of their skin's natural defenses and dramatically reduce exposure to injury risks in the bathroom. They conserve precious energy, allowing more strength for moments that matter, playing with grandchildren, pursuing hobbies, or simply enjoying a walk in the fresh air. This shift in routine is not merely physical. It is deeply psychological. The loss of independence that often follows injury can lead to isolation and despair. By adopting safer bathing habits, seniors reclaim autonomy and confidence. Caregivers witness fewer emergencies and are better able to support their loved ones without constant fear of accidents. I have seen the transformation in patients who have embraced these changes. Their skin regains softness and resilience, their spirits lift, and their days are marked by vitality rather than fatigue. These outcomes are a testament to the power of informed, compassionate care. To families and caregivers, I urge you to listen carefully and act thoughtfully. Encourage open conversations about bathing habits and safety, and work together to create environments that support this gentler approach. Small adjustments, a shower chair here, a grab bar there, combined with a willingness to rethink long-held routines, can make all the difference. For seniors themselves, I offer reassurance. It is not neglect to bathe less often. It is wisdom to honor the body's evolving needs. Cleanliness is not measured by water alone, but by respect for oneself and the choices that promote health and happiness. As a retired physician, my hope is that sharing these insights fosters a culture of care that is both scientifically sound and deeply humane. Aging is not a decline to be feared, but a phase to be navigated with grace and support. Hygiene practices must reflect this reality, prioritizing safety, dignity, and quality of life. In closing, remember this: embracing a safer, healthier routine for bathing is a step toward preserving independence and joy. It is a quiet revolution in self-care that acknowledges the complexities of aging and honors the resilience of the human spirit. May these words guide you or your loved ones toward choices that nurture not just the skin, but the whole person through the golden years and beyond. If you have found this message valuable, I encourage you to share it, engage in the conversation, and continue seeking knowledge that empowers your journey. Aging gracefully is within reach for all of us. As I bring this discussion to a close, I want to emphasize that the journey of aging is filled with challenges, but also with opportunities for growth, adaptation, and renewed understanding. The way we care for ourselves changes as our bodies change, and embracing this truth is essential for maintaining health, dignity, and quality of life in our later years. From everything we've explored, it's clear that the traditional approach of daily bathing may no longer serve the best interests of seniors. Aging skin is delicate, losing much of its natural moisture and resilience, making it vulnerable to damage from frequent washing. More importantly, the physical demands and risks associated with daily bathing, including falls, exhaustion, and injury, present real threats that can undermine independence and well-being. The profound lesson here is that sometimes less is more. Reducing bathing frequency to once or twice a week, combined with targeted hygiene practices such as sponge baths and careful cleansing of key areas, protects skin integrity and reduces hazards. It conserves energy, allowing seniors to focus on activities that enrich their lives rather than depleting their strength in risky routines. This approach is not about lowering standards. It is about redefining cleanliness to suit the unique needs of aging bodies. It respects the natural processes of the skin, supports safety, and honors the wisdom that comes with age. More importantly, it empowers seniors and their caregivers to make informed decisions that prioritize health and happiness. In practical terms, this means rethinking daily habits. It means trusting that the body's microbiome can help maintain balance if not disturbed unnecessarily. It means making the bathroom a safer place with simple modifications and reducing the frequency of full-body bathing to minimize exposure to hazards. And it means engaging in open conversations within families and care teams to tailor routines to individual needs. As a retired physician who has devoted much of my life to elder care, I am committed to sharing knowledge that helps improve lives. Though I am older myself, I continue to learn and strive to offer guidance that is grounded in science and compassion. My hope is that this message reaches those who need it, inspiring changes that lead to safer, healthier, and more fulfilling later years. Before we part, I want to invite you to reflect on this simple question. Do you think reducing daily baths to a safer, more personalized hygiene routine can improve the health and well-being of seniors, Please take a moment to leave your answer in the comments below by choosing either A. Yes, I believe adapting hygiene routines in this way benefits seniors greatly. B. No, I think daily bathing is essential regardless of age. Your thoughtful responses will help build a supportive community where we can all learn and share. If you found this video helpful, please consider subscribing to support the channel and enable me to continue creating valuable content. Additionally, if you feel moved to contribute, donations, no matter how small, are deeply appreciated. They encourage me to keep dedicating time and effort to bringing useful knowledge to you and many others. Thank you for joining me on this important conversation. Together, we can foster healthier habits and greater well-being for our aging loved ones.